Welcome back guys. Now in this video, let's discuss about autosomal recessive disorders. Already we have discussed about the autosomal dominant conditions. Now in this video, we will be discussing about the autosomal recessive disorders. See, what are the examples of the autosomal recessive disorders? See, before going to discuss about the examples of the conditions, first you should know that the autosomal recessive disorders are going to manifest. If anyone have these diseases are going to manifest from the childhood itself. So, childhood onset. Childhood onset. That's the first point, childhood onset. Second thing, see this autosomal recessive diseases, they will have complete penetrance. Penetrance is going to be 100%. So, penetrance is 100%, complete penetrance is going to be seen. Okay. What does I mean by, you know it? So, if someone have the genotype, okay, if someone have the genotype, every individual with a genotype is going to manifest the disease. It's not like the autosomal dominant diseases. I have explained you in autosomal dominant diseases very clearly what is penetrance and expressivity. In autosomal dominant conditions, the penetrance is going to be incomplete penetrance. Here the penetrance is complete. If someone have that kind of genotype, 100% he will manifest the disease. But autosomal dominant diseases are not like that. Even though the patient is having the genotype of a disease, still he cannot develop the disease, still he can escape the disease. So that is incomplete penetrance. In autosomal dominant conditions, here it is incomplete penetrance. What about the expressivity? In autosomal dominant condition, expressivity is going to be wide variety of symptoms, wide range of expressivity. Different people with the same disease will express different types of symptoms. Okay, I am the one who is having a Marfan syndrome and the other person who is having a Marfan syndrome, my symptoms will be different and his symptoms will be different. Okay, my degree of symptoms and his degree of symptoms will be different. Expressivity is going to be different. Autosomal recessive conditions are not like that. Expressivity is going to be very narrow. Almost everyone with the disease have the same kind of symptoms, similar kind of symptoms. The expressivity, the degree of symptoms is going to be almost the same with everyone. So, expressivity is narrow, that is all patients will show same symptoms. Okay, all patients will show the same symptoms. Now, the most important part, what are the examples of autosomal recessive conditions? The examples are anything, I used to remember something like this, anything which ends with the word urea. Okay, so phenylketonuria. So phenylketonuria, alkaptonuria, homocystinuria. Okay, homocystinuria. See anything which ends with the word urea or emia also. Okay, for example, sickle cell anemia. Sickle cell anemia. See, these are examples of autosomal recessive conditions. Still many are there, but I want you to go slowly with gaps. Okay, so phenylketonuria, alkaptonuria, homocystinuria, all these are ending with the word urea. So remember, these are the biochemical, these are the biochemistry abnormalities. Now we will discuss about them. So these conditions are following autosomal recessive pattern of inheritance. Autosomal recessive pattern of inheritance, which means the individual have to get this disease from both mother as well as father. Most of the times mother as well as they are the carriers of this alleles, and if the offspring gets this alleles, he is going to manifest the disease. Okay. Now, what are the other examples? Albinism. Okay, albinism. Congenital adrenal hyperplasia. Okay, congenital adrenal hyperplasia, where a female is going to look like a male, female pseudo-hermaphroditism. Okay, congenital adrenal hyperplasia, where the female is going to born with enlarged clitoris which looks like a micropenis. So, these females are thought to be males. Female pseudo-hermaphroditism, the most common cause of female pseudo-hermaphroditism is a congenital adrenal hyperplasia, where there is virilization, female is going to look like a male, that condition. Next, Friedreich ataxia. Friedreich's ataxia. Next, Wilson's disease. Okay, hemochromatosis. Okay, hemochromatosis. See, these are copper overloaded states. Wilson's disease is the copper overloaded state, and hemochromatosis is the iron overloaded state. Okay. Now, one point which I want you to know. Let's again come back. So, sickle cell anemia. So, what exactly is sickle cell anemia? You know it. Okay. Sickle cell anemia is a condition where the one amino acid is replaced by the other amino acid. The glutamate is replaced by the valine because of the point mutation. Okay, in the gene for the hemoglobin. See, this sickle cell anemia, it's a blood related condition, right? So blood related condition, it's an anemia which is autosomal recessive. But which blood related condition, which type of anemia is associated with the autosomal dominant pattern? Which anemia follows the autosomal dominant pattern? Hereditary spherocytosis, first disorder I have discussed in the autosomal dominant. Hereditary spherocytosis, anchorin defect, round RBCs, hereditary spherocytosis. Okay, so next, albinism, congenital hyperplasia, Friedreich ataxia, Wilson's disease, hemochromatosis. Okay, these are also autosomal recessive conditions. Next, followed by cystic fibrosis. Cystic fibrosis, which was a recent question in the exam. Cystic fibrosis, CFTR gene mutation, chloride channel defect, salty babies. Okay, so that condition, thick secretions are going to be seen in this condition. Next, ataxia, telangiectasia. Ataxia, telangiectasia. Okay, see ataxia and ataxia, two ataxias are coming. Friedreich ataxia and ataxia telangiectasia. See, both are autosomal recessive conditions where the patient is going to have the gait abnormalities. Next, Fanconi's anemia. Fanconi's anemia. Next, xeroderma pigmentosa. Bloom syndrome. Next, alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin. Okay, alpha-1 antitrypsin deficiency, which is going to cause emphysema. So, all this, whatever I have written over here, all these are examples of autosomal recessive conditions. Phenylketonuria, alkaptonuria, homocystinuria, these three things. Next, albinism, congenital adrenal hyperplasia, hemochromatosis, Wilson's disease, Friedreich ataxia, ataxia telangiectasia, congenital adrenal hyperplasia, Bloom syndrome, alpha-1 antitrypsin deficiency, Fanconi's anemia. Next, cystic fibrosis. These are the important things. Okay, xeroderma pigmentosa. So these are the important autosomal recessive conditions. You have to by heart what are autosomal dominant, autosomal recessive. 10 times, 20 times, 30 times you have to by heart them. These things should be printed in your mind. Okay, so autosomal dominant, autosomal recessive conditions completed. Now after this, let's continue. Sorry, one thing I have forgot. Okay, one thing I have forgot. Sir, not only this, a very important, take a note. Sir, inborn errors of metabolism. Okay, inborn errors of metabolism. What exactly are they? The lysosomal storage diseases. Okay, lysosomal storage diseases. Take a big note. Lysosomal storage diseases. Okay, and not only this, glycogen storage diseases. Okay, so lysosomal storage diseases or glycogen storage diseases, these are also coming under autosomal recessive inheritance pattern. So what we are discussing, I have discussed that the lysosomal storage diseases, okay, the lysosomal storage diseases as well as the glycogen storage diseases, they follow autosomal recessive pattern of inheritance. See, the point which I want you to know is, look here, most of the lysosomal storage disorders, see, for example, let me write, inborn errors of metabolism. Okay, inborn errors of metabolism. See, like glycogen storage disorders, lysosomal storage disorders. See, all of them are going to follow the autosomal recessive inheritance pattern. They follow autosomal recessive inheritance pattern, but there are two exceptions. So what are those two exceptions? Number one is Fabry's. So Fabry's disease, I will show you which is a lysosomal storage disorder, as well as Hunter's, not Huntington. Huntington is different. Huntington's chorea is autosomal dominant condition. okay, because of the loss of GABAergic neurons. That's a total different condition. There is a lysosomal storage disorder called as Hunter's disease. See, these two conditions, they follow X-linked recessive, okay, recessive. But all the glycogen storage disorders and lysosomal storage disorders, they follow autosomal recessive pattern of inheritance. But these two conditions, which is Fabry's disease as well as Hunter's disease, they follow X-linked recessive pattern of inheritance. Okay, this is a point which I want you to know. So now, let me show you one more important thing. Look here. In the lysosomal storage disorders, see, most of the lysosomal storage disorders, okay, these are the lysosomal storage disorders: Gaucher, Krabbe's disease, Tay-Sachs, Fabry's, metachromatic leukodystrophy, Niemann-Pick disease. These are the lysosomal storage disorders, right? See, most of them, they follow which inheritance pattern? Autosomal recessive, autosomal recessive, autosomal recessive. All of them are following autosomal recessive. Then who is following X-linked recessive pattern? It's a Fabry's. Fabry's follow X-linked recessive. And look here, one more, Hunter. Okay, Hunter is following X-linked recessive, but all other are following autosomal recessive pattern. Okay, so keep that point in mind. So now let's see phenylketonuria. So where we have discussed anything which ends with the word urea: phenylketonuria, alkaptonuria, homocystinuria, autosomal recessive pattern. So phenylketonuria, in this condition, what exactly is the problem? There is a deficiency of an enzyme called as phenylalanine hydroxylase. Phenylalanine hydroxylase deficiency is seen. There is one more condition called as alkaptonuria. In alkaptonuria condition, what is the deficiency? See, homogentic acid oxidase deficiency. Homogentic oxidase. Okay, homogentic oxidase deficiency. So because of the deficiency of this homogentic oxidase, there is accumulation of homogentic acid. Okay, this homogentic acid will start to accumulate in the body parts. It will go and accumulate in the cartilage, which is going to make the cartilage little blackish in color or brownish in color. Okay, so this condition is called as the deposition in the cartilage. Homogentic acid oxidase is deficient, leading to homogentic acid accumulation in cartilage. This condition is called as achronosis. Okay, this condition, what did we call it as? Achronosis. Okay, achronosis. So achronosis is seen in which condition? It's the discoloration of the cartilage. It's the discoloration of the cartilages due to accumulation of homogentic acid, seen in alkaptonuria. Now, let's discuss about some lysosomal storage disorders. Okay, Tay-Sachs disease. See, in this Tay-Sachs disease, what is the problem? There is a deficiency of hexosaminidase. So hexosaminidase A deficiency. Okay, so there is this enzyme which is called as hexosaminidase. It's going to break, for example, let me put it this way. Look here in the lysosomal storage disorders. See, Tay-Sachs. Normally the GM2 ganglioside. Okay, the GM2 ganglioside was supposed to be converted into GM3 ganglioside. GM2 should be converted to GM3 ganglioside with the help of an enzyme called as hexosaminidase A. When this hexosaminidase A is not there, it will cause which disease? Tay-Sachs. See, in which GM2 ganglioside is going to get accumulated within the cells, within the lysosome. See, within the lysosomes, the GM2 ganglioside is going to get accumulated. Okay, so look in Tay-Sachs. Let's see where exactly is Tay-Sachs. Yeah, here. See, in Tay-Sachs, what are the important points? Yes, it's of course, it's the lysosomal storage disorder, so autosomal recessive inheritance pattern. So there is decrease in the hexosaminidase A. So because of which the GM2 ganglioside levels are going to be elevated. So GM2 gangliosidosis, we call it as a GM2 gangliosidosis. Okay, so in this condition, what happens? The two important points which I want you to know is, see, there is the developmental delay in the baby from birth itself, and cherry red spot is going to be there. If you look at the lysosomes under the microscope, because of the accumulation of this GM2 ganglioside within the lysosomes, it's going to show the onion ring pattern. Okay, onion skin appearance, the onion ring like appearance is going to be seen within the lysosomes. Okay, so it's a progressive neurodegenerative condition. Of course, yeah, neurons are getting degenerated, motor losses will be seen, developmental delays are going to be seen, cherry red spot is going to be seen within the retina, and lysosomes are going to show the onion skin pattern. Okay, so let's see this one by one points again here itself. Come on guys, see these are the two funny slides which I have found it in the internet. I hope this will be helpful for you. So Tay-Sachs disease, where the neurons are getting degenerated. It's a neurodegenerative condition. See, the neurons are getting degenerated. Okay, so if you look at the neurons, within the neurons the onion skin lysosomes are going to be seen. See, there is accumulation of GM2 gangliosides. Okay, now what else you have to know is, see, there is hexosaminidase A deficiency, GM2 ganglioside accumulation. So in the retina you can see the cherry red spot. You can see the cherry red spot. The neurons are getting ballooned out. Okay, the neurons are getting ballooned out, and there is subsequent neurodegeneration will occur. Okay, there is ballooning of the neurons. See, there is onion skinning. These lysosomes are going to show onion skinning pattern. Okay, so developmental delay in the baby. Okay, hyperreflexias are going to be seen. That's the point which I want you to know. See here also, see in Tay-Sachs disease there is cherry red spot. See, there is a developmental delay. Okay, and see there is progressive motor and mental and visual deteriorations can be seen. All these are the features of the neurodegeneration actually. Okay, so Tay-Sachs disease is completed. Now after Tay-Sachs disease, the next disease which I want to discuss, the next lysosomal storage disease, it is Niemann-Pick's. In Niemann-Pick's, the points which I want you to know. Look, in Niemann-Pick's, yes, of course, it's autosomal recessive condition, no doubt. It's seen in Ashkenazi Jewish people, mainly in the Ashkenazi Jewish population. It's going to be seen. What is the deficiency, sir? Which lysosomal enzyme deficiency is going to be seen? It is sphingomyelinase deficiency. Sphingomyelinase deficiency is going to cause a Niemann-Pick disease. See, in the name itself, it's a sphingomyelinase. It's going to break down the sphingomyelin. As the sphingomyelinase is the deficient, sphingomyelin will accumulate. There is accumulation of the sphingomyelin. Okay, sir, what are the clinical features? Of course, it's a progressive neurodegenerative conditions. Yeah, neurons are going to get degenerated. Okay, cherry red spots are seen, which means the cherry red spots are not only seen in the before condition, that's a Tay-Sachs, but cherry red spots are also seen in the Niemann-Pick's. But it's also going to be seen in some other conditions also. True. So cherry red spot is not something specific to Tay-Sachs. It's going to be seen in multiple conditions. For example, here I have given the list. See, the cherry red spots in the retina. It's going to be seen in Tay-Sachs, this is true, but also going to be seen in Niemann-Pick's. It's also seen in Gaucher's and central retinal artery occlusion. Okay, central retinal artery occlusion, CRAO, CRAO. Okay, CRAO, central retinal artery occlusion. You can see the cherry red spot. Niemann-Pick's disease, Tay-Sachs disease, Gaucher's disease. In all these conditions, even in trauma, it can be seen. Okay. So that's not something specific. Again, important points about the Niemann-Pick's disease. The Niemann-Pick's disease, sphingomyelinase deficiency, accumulation of the sphingomyelin, going to show the cherry red spots. Hepatosplenomegaly, this is something important. Hepatosplenomegaly, which lysosomal storage disorders are going to be associated with the hepatosplenomegaly? Niemann-Pick's. And what else can be seen under the light microscopy? Not the onion skinning. Okay, an onion skin appearance is going to be seen in Tay-Sachs. Here what you will see, zebra bodies. Okay, zebra bodies, zebra like the stripes which are present on the zebra, that kind of appearance is going to be seen. I will show you. See, this is like a zebra lines. Okay, so within the lysosomes you can see this zebra crossing appearance. So these are called as the zebra bodies. So again, let's come back to our table. Here, look, now we are discussing about Niemann-Pick's, right? See, in the Niemann-Pick's area, it's autosomal recessive condition. Okay, decreased sphingomyelinase is getting accumulated within the neurons, within the lysosome. So neurodegeneration can be seen. Yes, progressive neurodegeneration. See, cherry red spot is seen. Hepatosplenomegaly, important. Hepatosplenomegaly is seen. What you will see under the light microscopy or electron microscopy is the zebra bodies. Okay, zebra bodies are going to be seen. So after Niemann-Pick's, the next disease, which was a recent question in the exam, that is Gaucher's disease. Okay, Gaucher's disease. Now, in this Gaucher's disease, every time this one question will come, see how the cell is looking like. The cell is looking like a crumpled tissue paper. You just take a tissue paper, you just use it, how it will look like? It's going to look like crumpling. Okay, it's not going to be even, it's going to have lots of folds, right? So this is like a crumpled tissue paper, the used up tissue paper. So crumpled tissue paper appearance is going to be seen in Gaucher's disease. This Gaucher's disease is because of what? It's because of deficiency. Deficiency of which enzyme? Which lysosomal enzyme? Beta glucocerebrosidase. Beta glucocerebrosidase. Okay, it's due to deficiency of beta glucocerebrosidase deficiency. Okay, the cells are also called as these cells which I am showing you. The cells are also called as Gaucher cells. These patients are going to have the main bone problems, bone pain. That's their main problem. Okay, bone pain is going to be there, as well as hepatosplenomegaly. Hepatosplenomegaly is going to be positive. So, in Gaucher's disease, what's the main problem? In Gaucher's disease, the main problem is bone pain. So, bone pain, these patients are going to have the bone pain. Hepatosplenomegaly is going to be seen. Crumpled tissue paper appearance due to deficiency of beta glucocerebrosidase. Okay, so let's come here to the table. Our table, see here, let's go for the Gaucher's disease. See, first disease, Gaucher's disease, autosomal recessive condition. What you will see? Beta glucocerebrosidase is going down. So, accumulation of glucocerebrosides. Okay, glucocerebrosides are getting accumulated. Hepatosplenomegaly is seen, developmental delay is seen. But the point which I want you to know is bone crisis. This is the keyword, bone pain, bone pain. Okay, hepatosplenomegaly, bone pain with the Gaucher cells which will show crumpled tissue paper appearance. Okay, so because of the bone related problems, these patients are also going to have vascular necrosis of the femur, That's what is going to cause the pain, bone pain. Okay, so these are some important points which I want you to know. All the lysosomal storage disorders are autosomal recessive except two. One is Fabry's, other is Hunter's. Fabry's and Hunter's, these are X-linked recessive, that we will discuss in the X-linked recessive disorders. So, with this, we have completed the autosomal recessive disorders. Again, I am telling you what are the important autosomal recessive disorders which you should know is all ureas, phenylketonuria, alkaptonuria, homocystinuria. Okay, and sickle cell anemia is going to be seen. One anemia condition, sickle cell anemia, albinism, congenital adrenal hyperplasia, Friedreich ataxia, ataxia telangiectasia, Fanconi's anemia, cystic fibrosis, xeroderma pigmentosa, alpha-1 antitrypsin deficiency is leading to emphysema, Bloom syndrome, Wilson disease and hemochromatosis. These are the important diseases which I want you to know. Okay, for sure you should know these disorders along with lysosomal storage disorders and glycogen storage disorders as autosomal recessive disorders. A point which I want you to know is one more point. Usually who will get this autosomal recessive disorders? See, autosomal recessive disorders are seen in the children who born, okay, seen in the children who born to the couple who married within the families. For example, there is consanguinity. Within the families they are marrying. Okay, within the families, within the close relation, they are marrying. So whenever there is a marriage, that's called as a consanguinity, consanguineous marriages. Okay, consanguineous marriage. So in those couple who are having the consanguineous marriage, their babies will get this kind of diseases. Their babies will get lysosomal storage diseases as well as glycogen storage diseases. Okay, so that's why it's always advised not to go marriage within the families because of this autosomal recessive conditions. Okay, and every generation will be affected whenever the patients are having the autosomal recessive conditions. In autosomal dominant conditions, every generation is affected. In autosomal recessive diseases, not every generation is affected. There is skipping of the generation. Okay, there is skipping of the generations. Okay, so one generation will be normal, one generation will be affected. One generation will be normal, the other generation, subsequent generations will be affected. That's the skipping. Skipping of the generation is seen in autosomal recessive pattern. Every generation will be affected in autosomal dominant pattern. Okay, that we will discuss anyway in the pedigree analysis. So with this, we have completed the autosomal recessive disorders. In the next video, we will discuss about X-linked dominant as well as X-linked recessive disorders. Thank you.